the 3 GP visits, ring fence for that. How did you come to that decision?
Well, ultimately, we need to make sure that, when people ask us, well, if you're going to tax us more, we want to know what you're going to spend it on. And clearly comes through so strongly over the last year. People are really concerned about the health system. Even more so, we've been asking people to tell us your stories around, your GP visits and how much you're paying for them. Some of the stories are horrifying. So ultimately for us, we believe that, and Aisha used that today in her stand-up. She used the survey which said, for every dollar you spend in primary healthcare, you save $10 in the tertiary healthcare system, so in hospitals, etc. So get them at the preventative stage as opposed to waiting till the condition gets so bad that they need to be hospitalised, because that costs New Zealand and costs the economy more.
We all know, I think that's a much better result for people to get to the doctor before they have to get to the A&E room. It does obviously mean more traffic to the doctors, though, which I think they were talking about in the story. It does mean that we have anecdotal stories at the moment of people having to wait 2 weeks to get to their doctor. How do we address the already apparent doctor shortage with people now, thankfully, having easier, well, not now, but if it passes, easier access to get to their GP?
Yeah, so Aisha, what was cut out of the story was she had actually not just announced the new Medicare with the free visits. She also went through a couple of initiatives that she had been working with general practice representatives, which would actually help them free up some capacity. So, for example, the government just today actually talked about AI scribe for emergency. Well, we're saying, well, you need AI scribe for general practice as well. There's facilities grants to help general practitioners grow the space that they have so they can have actually more visits. And so she's talked about the workforce, nurse practitioners, the ability for us around, graduate doctors being able to support them into getting into their first practices. So there was a whole list of different policies that she'd put out as part of this as well.